There's a type of breast cancer many women don't know about, one that isn't life-threatening but still requires treatment in case it spreads. Now, a new test can help predict a patient's outcome and in some cases help them avoid radiotherapy.
Yuki Tamara was diagnosed with breast cancer in March after having an ultrasound and mammogram.
Obviously, I was shocked.
The 45-year-old was diagnosed with ductal carcinoma in situ, or DCIS, where abnormal cells grow in the milk duct. It accounts for up to 1 in 5 breast cancer cases. If not treated effectively, it may spread to other parts of the breast or body.
Still, a substantial proportion will become cancerous if it's left alone.
This new sophisticated test called DCISionRT analyses the molecular markers of the tissue and uses artificial intelligence to determine whether a patient would benefit from radiation after breast-conserving surgery by assessing their 10-year risk. Melbourne breast cancer surgeon Professor Bruce Mann validated the test in 183 Australian women who were treated.
It identified about half of our patients for whom radiation would not have been of any benefit and half in whom the radiation was of benefit. It was a very pleasing outcome.
Yuki would have been considered high risk, but the new test showed the opposite and she was able to avoid radiation.
Significantly, I felt relieved.
If it's not necessary to have radiation, it's definitely a better treatment to avoid.
For the first time, Australian women will have access to the test through Genesis Care Oncology Centres. De-identified data will also be included in a global registry to further assess treatment decisions and to follow the outcomes of patients.
Making a case to the government ultimately.
Gabriella Rogers, 9 News.